Department of Veterinary Pathology, College of Veterinary Science is located on the ground floor of paraclinical wing of the college. The activities provided by the Department of Veterinary Pathology include teaching undergraduate and postgraduate students, guiding MVSc and PhD students as far as their research is concerned. We have undergraduate and postgraduate teaching through interactive and audiovisual modules. We provide services as performing postmortem of large, small and pet animals, laboratory and zoo animals for disease diagnosis. Department provides facilities of disease diagnosis using necropsy, cytology, histopathology and immunopathology. Diagnosis of the diseases by molecular and immunopathological techniques is also done. The department has very well equipped UG and PG teaching laboratories. We do have a clinical lab along with a museum of gross specimens. The department provides the facility of postmortem of large animals, all those animals which die in the clinic. So before opening the carcass, we externally examine the eyes, ears, oral cavity for any gross lesions, ectoparasites, snake bites, fractures. So gross examination of the animal is done thoroughly. Condition of the animal is assessed, whether the animal is emaciated or whether the carcass is healthy. Natural openings are examination for any secretions or excretions. Joints are observed for any lesions like foot and mouth lesions. Then opening of the animal is done. A thin incision is given from pubic symphysis to mandibular symphysis to de-skin the animal. After examining thoroughly the external surfaces of the body, ruminants, they are put on left side, the horse is put on right side, the legs facing you and the head on the other side. In ruminants on the right side and in the horse left side. So this incision is being given from pubic symphysis to mandibular symphysis. The purpose of the postmortem examination is to diagnose a disease. Postmortem become necessity in case of the animal dying in clinics after the treatment. All those animals which are insured in experimental animals, in veto-legal cases, in any outbreak happening in Punjab or around, the teams visit over there, they conduct the postmortem to ascertain the cause of death of the animal and to also collect the tissues for microbiology, toxicology, histopathology, so that the disease can be diagnosed in an outbreak. Other animals, they can be saved after diagnosing a particular disease, so that other animals, they are vaccinated if the disease is infectious. So these are prefemoral and prescapular lymph nodes. So lymph nodes, they are enlarged in many diseases. So after removing the skin, the carcass is put on to dorsal recumbency and we have to dislocate coxofemoral joint and axillary joint is being removed, dislocated, to put the animal in a proper position. Now the head is held and ventrolateral incision at mandibular region is given to remove out gently tongue along with hide bone, trachea along with arytenoid cartilage. So the tongue is held and a lateral incision is given at mandibular region on the ventrolateral part. So this way the tongue is held with one hand, hide bone is moved from hide bone, the purpose is to remove in a one piece tongue, trachea, arytenoid cartilage, lungs and heart as a one unit. So the tissues are being removed from the ventral attachments, gradually moving forward. So trachea is open, the cartilage rings are cut through, and we can take a sterile sample for microbiological isolation. Thyroid and parathyroid glands are also seen for any abnormality. The sternum is being cut, moving forward so that the thoracic cavity can be opened up, gradually moving toward the lungs and heart. With a gentle push, open up the thoracic cavity, revealing lungs and heart. So thoracic cavity is opened after cutting through the thoracic ribs. So pulmonary organs are being removed here. So now the tongue, trachea, arytenoid cartilage, lungs and heart have been removed. So examination of mediastinal lymph node is being done for any lesion, for any enlargement. So they are enlarged in many conditions of lungs. Again, with a sterile swab, we can take sample for microbiological examination from the primary bronchi or trachea. The lungs are palpated for any consolidation, any change of color, emphysema, atelectasis, hydrated cysts. They are cut through to see any exudate, any nodules. They are pressed to see edematous fluid. A piece can be taken and put into water. If it sinks, we can suspect it is pneumonic. A piece of lung tissue can be taken in a petri dish, sterile petri dish for microbiological isolation. It can also be taken for histopathological examination in 10% formalin. Most of the tissues, they are collected in 10% formalins for histological changes. So this is heart, which is covered by pericardium. The pericardium has been removed. It can contain a little fluid, but if it is in excess, it's called as hyperpericardium. It can contain blood, hemopericardium, or pus, what we call as pyopericardium. So heart is epicardium is seen for any hemorrhage, any lesion. It will be cut from apex to base to see internally any change into the endocardium or into the valves, chordae tendineae, papillary muscles. Again, the samples can be taken from here. The blood smear can be made. Different types of blood clots can be seen depending upon how the death has occurred. It can be chicken fat clot, it can be currant jelly clot. These are the chordae tendineae, papillary muscles, tricuspid valves. So they can be seen for any lesion like hemorrhage, presence of any thrombi, any vegetation. A piece of heart can be taken for histopathological examination. So this is spleen, which is seen for increase or decrease in size, presence of any vascular lesion, any necrotic foci. Abdominal cavity is open for examination of splanchnic organs. This is adrenal gland. If we put a finger anterior to the kidney, we can find adrenal gland. So it can be palpated gently and piece of it can be taken for histopathology. It is removed from the momentum. Try to remove whole of the GIT from esophagus to the terminal part as a one unit. Esophagus to post colon. On the esophagus, the thread is tied. Same thing is done at the post colon area to avoid spillage of intestinal material. So this is omentum. The mesentery is cut to reveal intestine. Here is the kidney. Both the kidneys are there, which are normally present at sublumbar region. So the kidneys are examined, they are cut on the dorsal side and try to remove the capsule. If it is removed easily, it means it is not suffering from nephritis or glomerulonephritis. In those cases, the capsule is adhered to the underlying tissue. This is how the kidney is cut from the dorsal side. It is opened up to see any lesion, circulatory lesion, any cyst, abscess, tumor, presence of calculi, to see the demarcation of corticomedullary junction. Liver is also examined. This is glycine capsule of the liver, which is inflamed in many conditions. Liver is cut horizontally and vertically to open up to see the internal areas for any cyst, abscess, tumors. Small piece of the tissue again can be taken into 10% formalin for histopathological study. So gallbladder is also seen. The bile duct is seen for its patency. The gallbladder is opened up to see the color of the contents, amount of contents, presence of any calculi. The mucosa is also seen for inflammation. These are mesenteric lymph nodes which are swollen in case of any inflammatory condition of the intestine, any neoplastic condition of the intestine. So mesenteric lymph nodes can also be taken up for histopathological study in case if they are showing any gross lesions. So then mesentery is separated from the intestine to straighten up the intestine so that the intestine can be examined internally for any parasites, for any inflammation. Many times there are many mechanical malpositions of viscera like prolapse, intussusception and torsion. In those cases we'll find massive congestion and hemorrhage at that place. This is the rumen which is not well developed in this calf. Reticulum, honeycomb-like structures are being formed. They are very well formed in adult animals. Abomasum, it is observed for presence of any ulcers after washing it with water. A piece of the intestine can be taken after tying the knot at two places so that the intestinal contents between the two knots. It can also be sent for toxicological study in those cases which are suspected. Gross specimens are collected at postmortem so that they can be shown to the undergraduate and postgraduate students for any gross lesions which are not normally observed. So they are put into 50% formalin. So this first one is the specimen of heart which has been cut through and which is revealing the endocardial hemorrhages. This is the specimen which is showing mural thrombus and endocardial hemorrhages. This is a gross specimen of blood vessels showing laminated thrombi indicating white and red alternating layers of thrombi. This is valvular thrombi, left and right atrioventricular junctions, vegetation they can be seen. This is hypertrophy of the kidney which can happen when other kidney undergo failure. It also happens in cases of nephritis. So we'll have to differentiate it after having histopathology whether it's hypertrophy or nephritis. This is hypertrophy of the myocardium. The lumen is very small. The myocardium is quite thickened. It happens because of systemic resistance. This is hyperplasia and hypertrophy of the prostate gland which is present on the surface of urinary bladder. This is the oesophagus of bird which is revealing nodules which happens because of metaplasia of oesophageal glands, and it happens because of vitamin A deficiency. This is the specimen of fibrinopurulent pleuritis. On the surface of pleura, lot of fibrin is seen. This can happen primarily or it can happen because of infection spreading from fibrinopurulent pneumonia. Infection can happen directly or from the lungs. So this is the specimen which is showing hemorrhages and ulcers into the stomach, which can happen because of renal failure. These are stomach ulcers in dog. These are multifocal abscesses. This is the kidney which is showing formation of cysts, what we call as hydronephrosis, because of back pressure of urine when it is retained because of any calculi into the ureter or into the urethra. Because of the back pressure of the urine, the area of the kidney undergoes atrophy and cysts they are formed. Similarly, these are the specimens which are showing hydronephrosis. This is the specimen which is revealing the kidney which is suffering from chronic renal failure. You can see the surface, altered surface, kidney having calculi at the renal pelvis. So this is the lung which is having suppurative pneumonia, pus-filled lung. This is interstitial pneumonia in which the lungs become leathery, which the cause is mostly viruses, mycoplasma. Lungs become shrunken, leathery. Inflammation of the joints, what we call as arthritis, can be seen grossly, and when we'll cut through, we can find accumulation of exudate into the joint. Valvular thrombus at the atrioventricular junction, which happens because of septicemia, injury to the valves, and then formation of thrombi, accumulation of platelets, fibrin, entangling RBCs and leukocytes, and which are seen as a vegetation. This is traumatic pericarditis, in which foreign bodies they penetrate the heart. This is a heart with again TRP, traumatic reticulopericarditis. We can see the fluid coming out from the pericardial sac. This is the core villosum or shaggy heart, in which the heart becomes bread and butter like. This is again the heart showing TRP, also called as hardware disease. Heart become shaggy, corrugated surface. This is fibrinous pericarditis. Lot of fibrin accumulates onto the surface. Again, it happens because of injury. The heart having hemorrhage is indicative of septicemia or toxemia, because those endotoxin they cause injury to the blood vessel. This is a pneumonia where the lungs become consolidated, liver-like, and it's called as hepatization of the lung. Small pieces of tissue has been removed for histopathology. This is the specimen of hemopericardium. This is part of heart which has been taken to show you clotted blood into the pericardial sac, which can press upon the heart, causing heart failure. Again, this is a fibrinopurulent pericarditis, preventing the dilatation of the heart, leading to chronic venous congestion or right side heart failure. This is fibrinous peritonitis, which can be seen in many conditions. Hemorrhagic peritonitis, massive hemorrhages onto the surface. Gastric ulcers in equines. This is a case of salmonellosis in horses, showing congestion in the stomach. Same case of salmonellosis in horse, showing congestion and hemorrhage. This is anasarca, where the subcutaneous tissue is filled with edematous fluid. This is liver, showing cirrhosis, chronic inflammation of the liver, multinodular cirrhosis. There are various types of cirrhosis. Again, this is cirrhosis. It has become hard, and you can see the nodules. This is a typical multinodular cirrhosis, revealing nodules, replacement of the parenchyma. This is telangiectasis, formation of the blood-filled cavities into the liver, telangiectasis. Again, this is another case of cirrhosis, which is a chronic inflammation of the liver. Liver becomes smaller, hard, and normal parenchyma is replaced by fibrous tissue, and it can become nodular. This is hepatitis. Causes are many. the angularity goes and the liver lobes become round. It is enlarged, the borders become round and the size become greater than normal. This is hairball in the stomach of a pig. Because of licking each other, these hairball, they can block the intestine, leading to the death of the animal. This is enterolith into the intestine of the horse. Hairballs can lead to this type of formation of stones on which many salts are continuously accumulated over a period, and ultimately it can block the intestine. This is the case of interception in a dog, when one part of the intestine moves into other part of the intestine because of increased peristaltic movement, and chronic venous congestion will happen, and ultimately the part which has gone in will undergo necrosis and then gangrene, and death of the animal will happen if we don't operate the animal to correct this condition. This is a case of hemorrhagic cecum, which result in colic in animals. Omasal infection in cows is very common cause of death. Diaphragmatic hernia, in which reticulum is seen in thoracic cavity, and in the lower specimen you can see aspiration of ruminal contents into the trachea and lungs. So it can lead to massive pneumonia. So rupture of intestine, which leads to colic in horses particularly, and peritonitis, they are seen over here. Hydrated cysts are very common in large animals. So they are seen as fluid-filled ball-like structures, and on cutting fluid will come out. Hemoprotectin diseases, theileriosis reveals punched out ulcers in the abomasum. In BVSc, the viscera is jaundiced, and in trypanosomiasis you can see in blood smears trypanosomes. This is a case of pyometra, accumulation of a large amount of pus, and when we examine the blood of these animals, massive increase in the number of neutrophils, which we call as leukocyte response, is seen. This is the case of suppurative mastitis. The pus has gone out and a cavity has been formed in the teat. This is a case of melanoma in horse tail. This is pituitary adenoma in horse. So pituitary adenoma, of course, is very rare, but it can lead to various types of symptoms, hair loss and abscess formation in various organs. This is lung tumor metastasis from a case of osteosarcoma. The mammary tumor in dog, very common. Many cases of these are being reported in the clinics. Lesion of snake bite can be seen in large and small animals on tongue or on the lip region. Electrocution, any animal can be seen when they encounter high voltage currents. This is a case of goiter in kid. There is hypertrophy, hyperplasia of adrenal gland at the neck region. These are the opened up thyroid glands. So this is a case of foot and mouth disease, ulcers in mouth, ulcers on the tongue, dorsum of the tongue, and on the heart it becomes tigroid-like appearance, and ulcers in the hoof region, they are also seen. This is a case of, again, foot and mouth disease, ulcers onto the dorsum of the tongue, ulcers on the dental pad is seen over here. This is case of swine fever. You can see the lesions onto the body and ears, and you can see the button ulcers in the intestine. It's typical of swine fever. This is case of contagious ecthyma. Wart-like lesions, they are seen on the commissures of mouth. Hemorrhagic septicemia is a very important disease of buffaloes. There is swelling of the throat because of edema. the lungs become pneumonic, and if you put a part of lung into water, it will sink, indicating pneumonia. And you can collect blood aseptically from heart for isolation of bacteria, and you can go for cytology, and we can see bipolar organism into the blood smear. So this is the same case where anterior ventral lobes are involved with pneumonia. This is suppurative pneumonia, again a case of Pasteurella multocida. A case of tuberculosis in which you can see dystrophic calcification. It is seen as a chalky material, and when we cut through the lungs which are suffering from tuberculosis, and if there is calcification, there will be gritty sound produced by those chalky material. This is Purley disease, a case of tuberculosis. Nodules take the shape of these types of lesion when they are particularly seen on mucous or serous surfaces. This is called as Purley diseases because of the resembling like pearls. This is tuberculosis lymphadenitis, in which the lymph nodes, they become stone-like, very hard, and we can isolate the bacteria with acid-fast stains. A case of Johnny's disease, paratuberculosis, in which the large intestine become corrugated because of accumulation of granulomatous tissue, epithelial cells, giant cells, lymphocytes. So villi, they become dilated with accumulation of this inflammatory exudate. This is acute case of Johnny's disease in which vascular changes are more prominent. This is tuberculosis and Johnny's disease. On the upper pictures, cases of tuberculosis in lung on the left side, and in the middle you can see those chalky masses of calcium salts into the lung suffering from tuberculosis. Mediastinal lymph nodes, they are also involved in tuberculosis, showing chalky masses. And in the left side of the lower picture, a case of tuberculosis in intestine has been shown. And in Johnny's disease, you can see the corrugation of the villi, and the bacteria, they can be isolated in TB and JD with acid-fast stains. They can be seen as magenta colored bacteria. It's a case of hydrated cysts in the lungs caused by Echinococcus granulosus. Again, case of hydrated cysts in lungs of the cattle. You can see large number of hydrated cysts. This is again a large hydrated cyst in the lung. Here it is in the liver. Punched out ulcers of thaliariosis, they can be seen. They are also hemorrhagic. Punched out ulcers, another case of thaliariosis, the button-like ulcers into the abomasum of the animal suffering from thaliariosis. This is a case of ascariasis in the intestine. These roundworms were seen in the intestine of a pig. Coccidiosis in a kid, you can see the hemorrhagic lesions and presence of nodules onto the mucosal surface. The nodules are very, very prominent onto the mucosal surface. This is hepatic coccidiosis. Milky nodules are seen onto the surface of liver. Now we come to the processing of the tissues collected at postmortem. So these are tissue capsules which are marked with the identification number of the animals, and the tissues taken at postmortem, they are sliced into small pieces of approximately less than 5 millimeter in thickness. So these pieces, they are put into these tissue capsules. So as many number of tissues can be collected at postmortem. So then these tissue pencil marked identification number put into water to remove formalin. So we can go for manual processing, or we have automatic tissue processor in our lab which can process the tissues. So first of all, after removing formalin from the tissue by putting it into running water, they are put into ascending grades of alcohol so that the tissues, they are dehydrated, water is removed. 70% alcohol, 80, 90 and then absolute alcohol. So after that, the tissues are cleared in acetone 1 and acetone 2, 20 minutes each. They are also cleared in benzene. They are to be made as translucent. Then the tissues are impregnated into paraffin. They are put into wax 58 to 60 degree temperature so that the clearing agent can be removed from the tissues. So 2 to 3 changes are given into the paraffin, and when these changes are given, the tissue capsules, they are removed from the paraffin, and then the process of embedding starts. The purpose is to make the paraffin blocks in which there are tissues. Tissues are taken from here, they are put into L molds, or they are put into these types of containers. So after putting the tissues, paraffin is put over it and a plastic cover it ultimately will hold the paraffin block, including the tissue. We use automated or manual microtome for rough cutting of the tissue so that from the paraffin which may have gone underneath the tissue can be removed and the tissue is exposed, because our purpose is to having a thin layer of tissue encircled by the paraffin. So now the tissue has been exposed and it is taken from the microsocket of the microtome. So all the blocks which have been made, they are rough cut and put into refrigerator for at least 2 to 3 hours at 0 to 4 degrees centigrade temperature so that it becomes easy to cut the tissues in the form of a ribbon. Tissues become hard. So again it is put into the socket of microtome. Automatic command can be given or it can be used manually. This is automatic microtome. So now 3 to 5 micrometer thin tissue slices are cut in the form of a ribbon. Every small part of the ribbon is having a tissue. So then it can be put onto, before going into the water bath, which is at the melting point of the paraffin, we can put it into on the alcohol so that it can spread. So then albuminized slides, they are taken. Mayer's albumin, thin Mayer albumin is put onto slide, and then slide is put vertically to take a part of this ribbon so that a tissue comes over to the slide. So purpose was to have a very thin section, 3 to 5 micrometer thin section onto a slide. So then these slides are put again into incubator at 60 degrees centigrade temperature so that the paraffin which is surrounding the tissue, it is melted and only tissue remains over there. So after half an hour, these trays containing slides, they are taken out, and now the slides are ready, the tissues are ready for staining. Because these cannot be examined under microscope, we will have to give some color to the tissue so that various parts of the cells, they can be examined properly. So these are various chemicals of a basic stain, what we call as hematoxylin and eosin or H&E stain. After putting these slides into these glass jars, so 10 to 15 slides can be stained at the same time. So you can see the pencil marking is the same which had been there onto the blocks. So now the tissues are deparaffinized with xylene. Leftover paraffin will be removed. Then we have to hydrate the tissues. Absolute alcohol 90, 80 and 70, and then passing into water, then decolorizing it. Hematoxylin and eosin stains are then used to stain various parts of the tissue. Hematoxylin is a basic stain which is bluish or violet in color, which combines with the acidic part of the cell, which is nucleus. And eosin, which is acidic stain and which is reddish or pinkish in color, it combines with the basic part of the cell, which is cytoplasm. So when we will be examining the tissues under microscope, the nucleus will appear bluish in color, while the eosin will impart the cytoplasm a pinkish color. So this is the principle behind the H&E stain. These staining methods have been standardized in decades by different scientists by putting through these different chemicals. The purpose is to make the tissue more translucent, to impart the nucleus and cytoplasm different colors. Finally, the tissues are cleared in xylene, and the slides, they become ready for mounting. So we can have a cover slip, and we can take up cover slip depending upon the size of the tissues. There are small and large cover slips, and cover slip is put onto white paper, and on it we can put a drop of mounting material. We use DPX as a mounting material. After putting a drop of it, slide is taken from the xylene, and the tissue side of the slide is pressed against this drop laden cover slip, and it is pressed from upside so that any air bubble goes out of in between the tissues and glass cover. So now this slide can be kept for 2 to 3 hours at room temperature, or if we want to examine it quickly, we can put it into low temperature into the fridge, and then we can examine within a few minutes under the microscope. So first the tissues, the slide is examined at lower magnification so that you can see overall the structure of the tissues, and then you can examine under higher magnification. So this is a multi-head microscope in which one person can show the slides to other individuals. This is how we go for examination of the slides which have been made after processing the tissues. So this is slide of congestion and edema in the lung. You can see a homogeneous color fluid into the alveoli, and there the blood vessels are dilated with RBCs. This is a slide of congestion, hemorrhage and edema in the lungs. So when the blood goes out of the blood vessel, it is hemorrhage. When it is more inside the blood vessel, it is congestion. And edema is a homogeneous fluid present into the body cavities. This is hemorrhage into the myocardium. You can see the RBCs out of the blood vessel. There is no evidence of the blood vessel, but RBCs are present in between the myocytes. Heart failure cells are the cells which are seen into the macrophages, which are laden with hemosiderin, which are seen into the alveoli or into the interalveolar septa of the lungs, and they are seen when the heart fails, particularly the left side of the heart fails. So there is a retention of the blood into the blood vessels, and RBCs undergoes autolysis, and hemosiderin is released, and the macrophages of the lungs, they take up these hemosiderin cells, and they are called as heart failure cells. So canalized thrombus, thrombus is intravascular intravital clot which obstruct the flow of the blood, and if the organ is not very important, the animal may survive, and this thrombus which is present, it can be canalized by the formation of new blood vessel from the adjoining endothelial cells. So you can see into the thrombus there are newly formed blood vessels which are lined by endothelium and which are having RBCs. This is a case of septic thrombus. On the right side you can see thrombus, and the left side you can see the myocardium of the heart, the valvular myocardium and endocardium, and this thrombus is septic because you can see small granular cells are present which are neutrophils. So thrombus sometimes got infected having bacteria, and neutrophils, they invade the thrombus, and this is called as a septic thrombus. Microthrombi in the gastric mucosa. Gastric mucosa has been destroyed by the fungi, most probably. We can see some septa of the fungus, and small blood vessels, they are occluded with thrombi. So microthrombi, because the blood vessels are small, they are capillaries or arterioles, and they are many in number into the mucosa of the stomach. These are microfilaria in the blood vessels of the liver, called as parasitic embolism. So anything which is foreign to the body moving into the blood circulation is called as embolus or embolism. It can be in the form of gas, liquid or solid form. Here these are the parasites, what we call as filaria, moving into the blood vessels or sinusoids of the liver, what we call as parasitic embolism in liver. Tumor emboli into the medullary sinuses of the lymph node, another case of embolism. Here they are in the form of tumor cells. So we can see the large sheets of cells into the medullary sinuses which may have come from anywhere in the body or from the regional area in which this lymph node used to be drained. Infarct in kidney. So on the upper side we can see the architect of the kidney, we can identify that it is kidney, but in the lower side it is very difficult to identify the tissue because it has undergone necrosis. So there is a line, red line demarcating live and dead tissue. So this happens in case of infarction. So that reddish area is a line of congestion is there in between live and dead tissue. So the dead tissue undergoes fibrosis from these blood vessels, monocytes. They go into the dead area as macrophages. So they phagocytize that dead tissue, and the fibroblasts, they proliferate and they convert this dead tissue into a scar. Infarct in liver, on the lower side we can identify the hepatic cords, but into the upper side there is organized tissue, fibrous connective tissue, and in between there is a line of demarcation, line of congestion between the infarct and living tissue. Cellular swelling, the cells are swollen with fluid when sodium potassium pump fails. More water goes in and the cell swells. That can happen in many types of mild type of injuries. Sinusoids are very much compressed because of the cellular swelling. This is cellular swelling at higher magnification. We can see the liver hepatic cords are very narrow. Hydropic degeneration into the skin of fowl. So again, accumulation of fluid lead to changes, degenerative changes into the cells, and it happens in case of fowl pox in skin. Fatty change into the liver. So all the hepatic cords, hepatocytes, they are filled with the vacuoles. So fatty change, the cause of fatty change, they are many because of many types of injury, hypoxic injuries to the liver. So the fat causes degenerative changes into the cell, push the nuclei into the periphery, and it leads to destruction of or ultimately it leads to cirrhosis of the liver. So this is higher magnification of the fatty change. Large vacuoles, they can be seen. So they can be seen in diabetes and many other types of toxicities and hypoxic changes. Glycogen infiltration can be seen as reddish granules into the cytoplasm of the liver. Mucus degeneration, you can see so many goblet cells which are not normally seen. So there is a hyperplasia of goblet cells. So this again happens because of bacterial infections or mild type of injury. To dilute the etiological agent, more mucus is produced by the intestine, which undergoes hyperplasia of goblet cells. So this is keratohyaline in skin. We can see the keratin pearls. Metastatic calcification in an artery. This is von Cosa stained. In H&E it is seen as bluish color. In von Cosa it is seen as black color. So metastatic calcification happens whenever there are higher levels of calcium into the blood. It undergoes precipitation into various organs, particularly which are acidic in nature. Metastatic calcification in the lungs. So here again black color calcified masses are seen into the interalveolar septa. So this is also very common in lungs when there are higher levels of calcium in the blood. Dystrophic calcification in the lung. This is case of tuberculosis. In the central area we can see a bluish color, H&E stained calcium salts. So dystrophic calcification because the calcium levels are same, but because of some necrotic change present into our body, the calcium has affinity for that necrotic tissue and it accumulates into old scars or old TB nodules. Coagulative necrosis. So there are various types of necrosis: coagulative, caseative, liquefactive. In coagulative necrosis, the architect is maintained but cellular detail is not maintained. We can't see any cell. We can see it is kidney, but the cellular detail is not there. It has undergone necrosis. This is coagulative necrosis in liver. Again, the architect is maintained, but we can find at places nuclei are absent, at places nuclei are pyknotic. This is liquefactive necrosis. So here in the central part we can't identify the tissue because both architect and cellular detail is lost. So the tissue is seen as a reddish homogeneous mass in liquefactive and caseative necrosis. So this is on the left side. Again, it's an example of abscess. On the left side we can't identify the tissue. It is because there is liquefactive necrosis. And on the right side there are changes which are happening around the abscess in as the chronic changes. This is gout in the kidney. It is specially stained with the D-glantha stain, and we can see the sharp crystals of gout in the kidney. This is hemosiderosis in the spleen, H&E stained. Golden brown colored macrophages which are laden with hemosiderin, they are seen into the spleen. So this is a special stain spleen suffering from hemosiderosis, Prussian blue, in which those macrophages which are laden with hemosiderin, they are stained as bluish color. This is anthracosis, a pigmentation in liver, accumulation of carbon particles into the lung, and this is an inert material, doesn't induce much inflammatory response seen in mules, donkeys working into the mines, or human beings living in industrial areas. This is a case of melanosis, accumulation of excessive melanin pigment. This is atrophy of the hepatic cords around the central vein because of chronic venous congestion. Prostate gland hyperplasia, we can see so many nuclei into a particular area. Bile duct hyperplasia, so there are formation of finger-like projections of the bile duct because of coccidia. This is serous inflammation, accumulation of serous fluid into the alveoli of the lung. It can happen because of early viral infections when the inflammatory cells, they have not appeared into the interalveolar septa or alveoli. This is fibrinopurulent inflammation. We can see a lot of fibrin into the alveoli along with the neutrophils, which can be seen in Pasteurella multocida or Pasteurella hemolytica. This is fibrinopurulent inflammation of the intestine. The surface is covered by neutrophils and lot of fibrin. Purulent inflammation, again large number of neutrophils are filling, and we can see the circulatory disturbances, congestion is there, so it means the condition is acute purulent inflammation or acute pneumonia. So this is purulent inflammation again. So darker bluish color areas are of accumulation of neutrophils also into the bronchioles. We can see it is filled with neutrophils. So this is purulent inflammation in the lungs. Suppurative inflammation mean when there is formation of abscess or pus from the hydrolytic enzymes of the neutrophils. On the left side we can see suppuration has been there, a pus has been formed, and this is a type of suppurative inflammation. Subacute inflammation mean when the vascular changes start disappearing and in place of neutrophils other cells start coming. So we can see some macrophages, they have come, neutrophils, they are less in number, and also vascular changes are subsiding. This is chronic inflammation. The kidney is being replaced by fibrous tissue, and we can see few tubules, but massive proliferation of connective tissue in between the tubules, leading to chronic inflammation. So lymphocytic inflammation mean there is accumulation of lymphocytes instead of neutrophils. So that can happen in certain viral diseases like FMD. So here in between the myocardial fibers there are large number of lymphocytes leading to degeneration of myofibers. Granulomatous inflammation, in which we can see epithelial cells, fibroblasts and lymphocytes seen in chronic diseases and some fungal diseases. So this is typical epithelial and Langhans type of giant cell. So when the pattern of giant cell nuclei is in the form of horse shoe, it is called as Langhans type of giant cell, and it is formed by when many epithelial cells join hands to form this type of giant cell under the influence of interleukins. So this is again granulomatous inflammation. This is foreign body giant cells when the nuclei of epithelial cells, they are accumulated at one place, at one periphery. So this is again granulomatous inflammation, a case of tuberculosis in the lung. We can't identify that this is lung, but in the central area there is dystrophic calcification which is surrounded by epithelial and giant cells, and then it is surrounded by lymphocytes and a connective tissue layer. This is a typical TB nodule, microscopically granulation tissue. So same slide can be seen in different ways. We have seen on the left side there is suppuration, but on the right side we can see the proliferation of fibroblasts. Healing tissue is being formed around the abscess. When abscess become old, it is surrounded by fibrous connective tissue, and connective tissue layer is formed around it, and we can call it as a chronic abscess. So chronic epicarditis, the surface of the heart is covered by macrophages and fibroblasts, and it can lead to compression of the heart. Fibrinopurulent pericarditis, on the surface of the heart into the pericardium there is accumulation of large amount of fibrin and neutrophils, and this again compresses upon the heart, and it can lead to death of the animal, and mostly this happens because of traumatic reticulopericarditis. This is higher magnification of fibrinopurulent pericarditis. This is purulent myocarditis. We can see a patch of neutrophils. A small abscess has been formed into the myocardium, and this happened because of infiltration with pyogenic bacteria. Fibrinopurulent pneumonia. So we can see large amount of fibrin filling the alveoli and neutrophils, mostly seen in Pasteurella hemolytica, very severe type of pneumonia when fibrin leaks out of the blood vessels into the alveoli and the lungs become consolidated. Fibrinopurulent pneumonia, again at higher magnification, we can see clearly the neutrophils and fibrin filling the alveoli. Acute purulent pneumonia, so vascular changes, they are still there along with accumulation of neutrophils into the alveoli. Fibrin is not there, so we will classify it as acute purulent pneumonia. So this is suppurative pneumonia where a small abscess has been formed. So abscess is nothing but the pus, which is degenerated cells of the body and dead bacteria and hydrolytic enzymes of the neutrophil. They cause formation of pus. This is higher magnification of the Langham type of giant cell are clearly seen along with epithelial cells and lymphocytes along with fibroblasts around the centrally caseative necrotic area, which is infiltrated with the calcium salts. Granulomatous inflammation at lower magnification, where we can see a typical TB nodule microscopically. So again, granulomatous inflammation in the lung, where dystrophic calcification, caseative necrosis in the center is seen. This is the slide of multiple granuloma in the liver, which are very common in Salmonella, and these multiple granulomas lead to degeneration of hepatocytes. That granuloma at higher magnification, we can see the cellular infiltrate in between the hepatic cords. This is Grocot's stain, silver stain, which stain black color the fungi, hyphae or the spores of the fungi. This is tuberculosis, TB nodule onto the left side, and Mycobacterium bovis, which has been stained with acid fast onto the right side. TB bacilli, typical TB bacilli, they are seen over here. TB nodules again onto the surface of the organ, and on the right side a normal lung has been shown. This is again TB tubercle at lower magnification. Here we can identify that this is lung at the periphery. A very high magnification revealing caseative necrosis, dystrophic calcification, Langham type of giant cells, epithelial cells, and fibroblasts along with some congestion. These are acid-fast bacteria, magenta-colored acid-fast bacteria, which are stained with acid-fast stain. In JD and tuberculosis, we can stain both these bacteria into tissue sections, into epithelial cells, into giant cells, or in between the tissue cells. This is higher magnification of those bacteria. This is a case of paratuberculosis or Johnny's disease, and you can see the corrugation of the villi of the large intestine and on the right side it has been compared with the brain. Microscopic lesion in JD, so the villi they become broader because of accumulation of epithelioid lymphocyte. So here we can see giant cells, and on the upper side we can see the broadening of the villi of the intestine because of infiltration of inflammatory cells. This is a granulomatous type of inflammation. So Ziehl-Neelsen stain demonstrated acid-fast rod-shaped bacteria which crowd the cytoplasm of epithelioid cells. So this is actinobacillosis called as wooden tongue, involving soft tissues, and we can see formation of pyogranulomas onto these organs, and the tongue become very hard. So microscopic lesions, we can see the pyogranuloma having discrete colonies of organisms which are surrounded by radiating clubs which consist of phosphate sulfur granules. They are suspended in pus and they are encapsulated with dense connective tissue. So around colonies there are neutrophils which are further surrounded by granulomatous type of inflammation. So this is basically pyogranuloma around the discrete colonies of organisms. Actinomycosis, also called as lumpy jaw. So here we can see there is formation of an abscess onto the hard area or mandible of the animal. So again, these are those colonies or pyogranuloma of actinobacillosis or actinomycosis, revealing neutrophils. These are many colonies of those bacteria into the tissues, and the type of inflammation is pyogranulomatous. So this is again a slide from hemorrhagic septicemia, in which there are vascular changes and few neutrophils are coming into the alveoli, but still they are very few, mostly vascular changes. So this is a percute case of HS, in which only vascular changes are there. After some time, neutrophils, they come from those blood vessels. When bone marrow is stimulated, they fill massively the alveoli, which are replaced, the air is replaced by the accumulation of these neutrophils. So this is acute purulent pneumonia, a case of HS. An animal can die quickly in this phase of the disease. This is case of listeriosis, also called as circling disease, in which the brain is involved. Brain can have micro abscesses, and they can be diagnosed after taking a brain tissue and doing histopathology. So micro abscesses, they can be seen into the medulla. So they can be very well differentiated. This is microscopic picture of the same. We can see two small abscesses into the brain, and at higher magnification we'll see it consists of neutrophils. So here is higher magnification of the same, and it is a small abscess, what we call as micro abscess. So this is immunohistochemistry of the same, and the bacteria, they can be demonstrated into those micro abscesses. So this is leptospirosis, revealing interstitial nephritis. Fibrosis along with the accumulation of mononuclear cells is happening in this case, and this is typical of leptospirosis, interstitial nephritis, when most of the glomeruli and tubules, they are replaced by fibrous tissue and mononuclear cells. This is swine erysipelas, called as diamond skin disease. You can see the skin lesions, very typical of this disease. Salmonellosis, in which paratyphoid nodules are seen. You can see the mononuclear cells on both the slides at lower and higher magnification on the right side.
To watch more educational videos on veterinary and animal sciences, subscribe the channel and please touch the bell icon. Guru Angad Dev Veterinary and Animal Sciences University, Ludhiana on YouTube.